How old is too old to become a mother? With advances in assisted reproductive technology, some overseas clinics boast success with women into their 60s. But the practice poses ethical, moral and medical questions. A Melbourne woman who gave birth at 61 is now the mother of a baby girl after travelling to India for treatment. As Tracy Bowden reports, she claims that what should be a joyous experience has been marred by the judgment of others.
She's fantastic. She's the most well-behaved and the most healthiest and most beautiful child in this world.
Little duck? Wow, let me see. Let me count how many teeth you got.
She's the baby this mother thought she'd never have.
She came to me like an angel, so I just named her Angel.
Shami Powell and Lucas Aurora met in their late 40s and knew that starting a family would be difficult.
We were a childless couple and we were craving for a child. I loved everybody else's children and only prayed that I get one for myself.
First, they tried IVF in Australia.
And I was on the waiting list for quite some years, and then they said to me, "Oh yes, you're right on the top now." "Oh, I'm sorry to say you are on a cut-off line. You are on a cut-off list because you are on a cut-off age, so we cannot give you a baby."
And what age was that?
52.
There are no laws limiting the age at which women in Australia can be offered assisted reproduction. It's up to individual clinics to make an assessment.
As a woman gets older, there are medical risks for her which accelerate as she gets over the age of 45. And from the baby's perspective, there are specific risks of being pregnant in an older woman, but also the concern about this child's rearing. It's an unusual situation for women who should be grandparents being mothers.
It's an instinct in a woman that they must become a mother. And for my daughter, I tried a lot, very hard to find someone who can give her a child. And finally, I saw this ad in an Indian paper.
The ad was for this clinic in India. Fertility specialist Dr. Mehul Damani is proud of his success in helping women as old as 60 have babies.
Every lady has I think, physiological and emotional structure made by the God that they want their own child from their own body. So that is, I think, Samipal wanted.
Dr. Damani explains that prospective patients undergo extensive screening.
Every 10 couple approaches at this age to us, we select only one couple to actual treatment. So this is how Samipal went through all the tests and she found fit for the emotionally, physically, medically, and then we started treatment on her.
And at that point, were you worried about your age?
No, I wasn't, because I thought I'm physically fit, I'm very healthy, I'm highly educated, I'm capable, in every respect, like morally, financially, mentally, bodily, I was all prepared for it. So I thought, oh, if I get a baby, wouldn't that be nice?
Using a donor egg and sperm, an embryo was created, then transferred. It worked. At 61, she was pregnant.
From day one, per every scan, we were told that the baby is very healthy, her heartbeats are very normal, and she's very active.
The couple returned to Australia to prepare for their baby's birth at the Mercy Hospital in Melbourne. From the beginning, they sensed that a number of staff disapproved.
They thought that you could be sick in the head to be having a baby at this age, or you could be just really silly, or this could be the biggest crime you've ever done to get a baby at this age.
Doctors told Shami Powell that she would need to have a caesarean section.
The doctor said that we have to have the baby operated, otherwise I can't give you a live baby. I told the staff and the doctors that, look, I totally deny being operated on. I would go for full term. I have no problems, no complications, and the baby is absolutely perfect, which proves with all the sonography reports.
Do you think that the medical staff had your best interests at heart, though, and the best interests of the baby at heart?
No, they were not worried about me at all.
Mercy Hospital told 7:30 its staff tailor their care for the individual needs of each patient, but due to patient privacy, declined to respond to Shami Pal's specific complaints. Angel was born on September the 12th last year. It soon became clear there was a problem.
I started feeling quite, queer about this, that something's going on, and they're not letting me go near my baby, as if I'm going to chew my baby alive. And there were people marching in and out of my room, hospital room, where I was for recovery, and there was social workers and all these other people that they invited in unnecessarily just to create more hiccups and hassle for me. I thought, what's going on? Who are they?
The authorities were investigating whether the new parents were capable of looking after their baby.
We were shocked. Everybody else has a baby and takes the baby home and brings the baby up the way they want to. Nobody gets told or educated or pressured on, this is how you must do this, this is how you must do that, and if you don't, we take the baby to a foster home or we take the baby away from you. And at the end, they found nothing wrong with us.
The Victorian Health Department told 7:30 it's obliged to assess and respond to all reports made about welfare concerns for children. The age of carers is not a factor. Shami Pal says she still suffers terribly from post-operative pain after the caesarean.
I do my best to dissuade people, but provided all the appropriate risk factors are taken into account, then if people want to go overseas and utilise these services, well, so be it.
Hey, baby.
Angel is now 7 months old and is at home with her parents and grandmother.
As soon as she sees me, you see her face light up and she smiles at me.
What do you say to people who believe that at your age women shouldn't have children?
Women at any age can have babies, and that is proven by the doctors around the world. Successful doctors have proven that, and I think they should be given a chance.
How do you feel about being possibly Australia's oldest mother or one of Australia's oldest mothers?
Well, Tracy, to be honest, if I was one of the oldest mother, say for example in a country like India, I would have been given a bravery award. But here I've been condemned, and I've been looked at as if this was the biggest mistake I've ever done.
And you don't think it's unfair to her to have parents this age?
Absolutely not. I think we're going to be the greatest parents and perhaps the most best parents, because we've got a miracle baby. Don't forget that.